Alright guys, welcome back to Biology 224. Today we're going to be going over Lab 15, the reproductive system. We're going to start off with the male reproductive system. Starting off with the scrotum, just this generic kind of word for the underside of male genitalia. And then when we go over the layers of the testicles, we're going to talk about 4 layers specifically. They are going from superficial to deep. They are the scrotal skin, the dartos muscle, which is this red layer, the superficial scrotal fascia, which is more of a blue layer, and then the cremaster muscle is the most deep, kind of like a pinkish layer. You'll be able to see this a lot better in lab. Lots of TAs have developed lots of interesting kind of clever mnemonics, and you can definitely ask your TA to help you with different ways of learning that. Next up, we're going to talk a little bit about just the basic kind of anatomy of the penis. Starting off with the bulb of the penis. It's going to be on the inside, kind of more posteriorly. The crus of the penis is going to be on the other side of the urethra from the bulb. It's this part that's all internal, so you would never be able to see any of this. The body of the penis, or shaft, and then the glans of the penis, which is the head of the penis, or the tip. Next up, we have the external urethral orifice. That's just this opening where either ejaculate or urine comes out. Prepuce is going to be the anatomical term for foreskin. We have a model that shows that. Ask your TA to show you the Shrek model. They'll know exactly what I'm talking about. And then we have the corpus cavernosa and the corpus spongiosum. Corpus cavernosa is going to be this sinus on the more anterior end, and then the corpus spongiosum is going to be more on the inside, or kind of more posteriorly. Next up, we'll talk a little bit more about the testes specifically. When you look inside their testes, you'll see all these different little tubes. Those are going to be your seminiferous tubules. You'll be able to see those really, really well on the cadavers. They almost kind of look like ramen noodles. It's kind of cool. Next up, we have the epididymis, which is going to be this sort of gland on top of the testes. So this is a testes. This is the epididymis. We have the spermatic cord, which is this entire cord kind of going up from the testes into your abdominal cavity. The ductus deferens is going to be the specific duct that carries sperm from your testes into your ejaculatory duct, which you can see on this other model. So the ejaculatory duct is going to be this little subdivision kind of coming out from the prostate gland, which is this entire gland right here. And then your urethra is this tube where urine and ejaculate flows out. And then you can take a minute to look up bulbourethral glands when you are in lab. Next up, we're going to start talking about some of the anatomy of the ovaries. We're going to switch over to the female reproductive system. Starting off with the ovaries, you can see right here. Next up, a different couple sections of the uterine tube, which is this entire structure right here coming right off of the ovary. We have the fimbriae. Next up, just a little bit over, we're going to have the infundibulum, which is just behind the fimbriae. Then the ampulla, kind of as we're making that turn. And then the isthmus. Connecting the ovary to the uterus, we have the ovarian ligament, which you can see pretty well right here. We have the broad ligament, which is all this kind of tissue right here. You can see the broad ligament kind of looks like a bat wing. The mesovarium of your uterus is going to be all this tissue that's kind of jumbled in between your ovary, your uterine tube, and your uterus. And then you have your uterus with your cervix and a couple other terms which we're going to go over in a little more detail right now. So starting off with the cervix, this structure is the cervix. You have an internal os and an external os of your cervix. In between those two, that little canal is going to be your cervical canal. All that space on the inside of the uterus is going to be your uterine cavity. And we have 3 layers when we're talking about the uterus. The outermost layer is going to be the parametrium. The middle layer, the muscular layer, is going to be the myometrium. And the inner layer is going to be the endometrium. You guys might have heard certain terms like endometriosis before. That has to do with the inner lining of the uterus. Hopefully it kind of makes sense. A lot of these terms match, for example, like the cardiovascular system, where you learn the pericardium, myocardium, and endocardium, going from outer to inner, parametrium, myometrium, endometrium. So hopefully that kind of makes sense. Next up, we're going to combine these models and we'll talk a little more about these structures as they relate to each other. We have the labia minora and the labia majora on the outside. The clitoris, you can see right here. The mons pubis is going to be the outer more tissue area on the outside of your skin. This is typically like the pubic area where pubic hair grows. And then you can take a minute to look up the greater vestibular gland when you get a chance in lab. Last but not least, we're going to talk about some of the muscles of the pelvic floor. Starting off with the bulbospongiosus is going to be the most medial. The ischiocavernosus is going to be more lateral. And then going across is going to be our superficial transverse perineal. And then your external anal sphincter, which you can see kind of on the inside. Hopefully you remember this from digestion a little bit. This is the internal anal sphincter. This is going to be the external anal sphincter. So that will conclude this week's video. Good luck on your guys' quiz and stuff this week, and I will see you next week for Lab 16, the last lab of your semester.